to begin, Vasanti?
Thank you. Hello, everyone. Good afternoon. Thank you for making the time to attend the inaugural community. Diana Urajnik, Peter Gill, and Rebecca Gannon, our co-leads for the Early Career Researcher Initiative. They've been working hard and trying to get this piece pulled together. We at the support unit are very happy that we've got such efficient co-leads and working with them. So through this journey, you will get to know us, them, and the broader community of research leads that we have for OSSU. Thank you again for attending. Over to Diana.
Thank you so very much, Vasanti. Good afternoon, everyone, and I'd like to echo Vasanti's words and her welcome to all of you. So welcome to OSSU's Early Career Researcher inaugural event. I'm Diana Urajnik from the Center for Rural and Northern Health Research, one of the co-leads, as Vasanti has mentioned, for the Early Career Researcher Initiative, along with my colleagues and co-leads, Peter Gill from the Hospital for Sick Children, and Rebecca Gannon from McMaster University. So we're very pleased to welcome you and to see so many early career researchers on the line today, which is wonderful to see. So the session today is our opening event for a patient-oriented research community of practice built for ECRs as part of the ECR initiative. And it's intended to introduce you to OSSU to set the context for the initiative, considerations for patient partnership and reflections and emerging issues and opportunities. Before getting into our community of practice, what that means and where we're headed, and also showcasing some examples of resources and supports also for impactful patient-oriented research through a really fantastic lineup of speakers that we're so very grateful to have here with us today. Just for a tiny bit of troubleshooting or housekeeping, sorry, and troubleshooting if we need to get to that in terms of questions and comments, they can be placed in the chat, which we'll be following. And we've also reserved some time at the end for questions for speakers and some facilitated discussion. So please come to us with all of your questions. So without further ado, I'll now invite Dean Ferguson, scientific lead for OSSU, to say a few words, opening remarks. Dean, over to you.
Great. Thank you, Diana. So my name is Dean Ferguson. I'm the scientific lead for OSSU, and I'm here to talk about, I'll be talking a bit later about the various methods support, but right now I'd like to, are you, sorry, Diana, are you going to put up the land acknowledgement, or do you want me to put it up? I think.
Diana, you're muted, sorry.
Yeah.
Oh, there we go. Dean, if you could go ahead. I don't have the land acknowledgement.
Okay, just one sec here. I'm sorry.
That's okay.
Okay, sorry, folks. Just technical difficulties here. Yeah, we like to start with a land acknowledgement, and we acknowledge that OSSU is located on the land we now call Toronto, and that OSSU operates across Ontario, which is home to many diverse First Nations, Métis, and Inuit peoples from across Turtle Island. Toronto is on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is covered by Treaty 13, signed by the Mississaugas of the Credit. We are deeply grateful to the generations of people, past and present, who have tended this land and acknowledge the abiding wisdom of the Dish with One Spoon Treaty to share and care for it. As settlers, we are thankful for the opportunity and privilege to meet and work here, and we seek to move forward with humility, respect, gratitude, and meaningful relationship building. So as I said, my name's Dean Ferguson, and I'm the scientific lead for OSSU. And I think it's just great to see this initiative move forward. It's an important initiative to OSSU. I've been witness to the cultural shift of patient-oriented research in the province, and I've also been witness to it being embraced and adopted by many early career researchers. And we'd like to think that OSSU has played a part in that. Certainly in our renewal, our emphasis on early career researchers is a priority. It's front and center within the renewal through our training and capacity development priority. And specifically, we aim to train and support early career researchers to become patient-oriented researchers through our Early Career Researcher Initiative, and that is led by Peter, Rebecca, and Diana. And we hope to bring training and capacity building through our OSSU centers, but also the development of this Early Career Researcher Community of Practice. We have also situated early career researchers within our own governance. So our management committee, our OSSU management committee, or OMT, all three, Rebecca, Peter, and Diana, sit on that committee and are active members. We've also embedded early career researchers within our working groups, and certainly within our 14 OSSU research centers, which you'll be hearing about throughout the day. So with that, I just like to thank you for all being here. I think it's exciting space to be in, and I encourage you to check out our OSSU website for resources and information to help our research community, and in particular the early career researcher community. And also a special thanks to Peter, Diana, and Rebecca for all the great work they're doing on the front. So with that, I'll turn it over to Hillary with a bit of an introduction to OSSU. Hillary?
Hi, everyone. My name is Hillary Edelstein, and I am an Assistant Director at the Ontario Strategy for Patient-Oriented Research Support Unit. OSSU was set up by the Canadian Institutes for Health Research in 2010 to address the evidence to policy practice gap in health system research, and patient engagement. SPOR is a matched funding initiative between the Canadian Institutes of Health Research and the Ontario Government's Ministry of Health and Long-Term Care. A support unit is located in every jurisdiction across Canada. Next slide, please. In Ontario, OSSU operates using a decentralized model led by a central coordinating team at the support unit. OSSU is led by Dr. Vasanthi Srinivasan, who has extensive experience in government and bridging across and between policymakers, researchers, patients, and other community stakeholders. Our nimble team at the Coordinating Center brings expertise in patient-oriented research, research methods, stakeholder engagement, and knowledge mobilization. OSSU's goals are to engage and connect patients and caregivers, researchers, health providers, policymakers, and industry, while accelerating and enabling research evidence to be integrated and taken up into policy and practice. OSSU works to help transform health and health service research in Ontario to one that embraces patient-oriented research approaches. Since its inception in 2014, OSSU has made great progress towards these goals, with the additional aim of achieving the quintuple aims of reducing costs, improving population health, improving the patient care experience, improving health provider well-being, and advancing health equity. Overall, OSSU provides support services, including research and capacity development, to respond to the patient-oriented research needs of health researchers, health system leaders, policymakers, patients, and more. All this is done with the oversight of a board, our funders table, which is represented by our funding partners, including Sick Kids Research Institute, CHIO Research Institute, the Ottawa Hospital Research Institute, St. Michael's Hospital Foundation, Hôpital Montfort, the Institut de Savoie Montfort, our scientific lead, Dr. Dean Ferguson, and the operations management team, which is a network of the leads of the 14 research centers and 8 initiatives. The OSSU website has more extensive information on our services, offerings, and impact, and I do hope that you will browse through it, and you'll hear more about OSSU's resources and services later in the presentation. I will hand it over to a key member of OSSU's patient team, Maureen Smith, to give the patient perspective, context, and a reflection of her experiences. Thank you.
Hi, everyone. Nice to see you here. I'm calling my very short presentation, a whirlwind tour, because I'm setting my timer. I'm going to do all this in 5 minutes. So I'm grateful for the opportunity to join you today to share a little bit about my perspectives and a little bit about some of the new frontiers in patient-partnered research that you may not be as familiar with. Next slide. So if you need a rationale for why you should be doing patient-partnered research, I think this probably says it all. Next slide. So just to make sure we're all on the same page, which is really important in patient-partnered research, what we use the CIHR definition, and you'll often hear the term patient partner, which is how I like to identify myself. So it's when we contribute to the research process and research-related activities, and different from that more passive role, but as equally important as a research participant. And that is at all stages of the research process, including supporting grant applications, which is a newer area where we're seeing a lot more of that there, and research dissemination activities. Next slide. So I'm going to concentrate a little bit on the new frontiers. So one big area where we've seen a lot of engagement now is youth engagement. And that's fairly new, and there's not a lot of guidance on that. So people are learning from each other. So really important in your community of practice that if you're doing youth engagement, that you share your best learnings. There's patient engagement and evidence synthesis. So for example, systematic reviews. So there are people who openly say, stay in your own lane and stick to primary research, but actually there's a lot of evidence that patient engagement, evidence synthesis is really important too. We have more focus and better understanding of equity, diversity, inclusion, and Indigenous ways of knowing, but a lot of work to be done in that area. With the co-development of core outcome sets, which has really been a big thing now for about 7 years. Patient engagement and reporting guidelines, which is pretty far removed from the patient experience, but also very important, and in the governance of research networks. So next slide. So I'm not going to touch on all of them, but a little bit about the youth engagement. So there's often a gap between that need to respect and protect young people, especially vulnerable young people, but to recognize their capacities, and that those institutional timeframes and processes are not always aligned with their everyday lives. So there's some considerations there for you as a researcher. In evidence synthesis, which is like an area where I have a lot of interest. It's not as intuitive as disease-specific primary research. So communicating, if you are engaging with patients there, communicating the purpose and why the engagement is important is really where you need to start. And there will definitely be training and support requirements that'll be different than research that's been in primary research. Next slide. So reporting guidelines, it's been about 3 years now that reporting guidelines are actually engaging with patients, and I'm doing one right now on Spirit in Concert for Children, where we have a youth advisory group and where we're doing workshops with youth. So it's important that we tell researchers what's important to us when you're writing up your reports. What is it that we want to know? And that's never been asked before. So that's a really exciting new area. There's no roadmap, it's just starting. And again, in that area, you require training to do meaningful engagement, both from the researcher side, welcoming those people, and from the patient and public side. Next slide. So I'm involved, or have been involved, starting, finishing, or in the middle of 6 core outcome set development, co-development in pediatric outcomes, 4 of them in rare diseases and 2 in mental health. And this is a big area. So it's really important. These are examples from mucopolysaccharidosis core outcome set. It's really important that we have a core set of measurements that are the same, and that those core measurements and those core outcomes are also determined by what's important to patients and their families. So next slide. So this is an issue because we can't combine the evidence, so making it hard to make those treatment decisions. And then the whole data collection and analysis of many outcomes is costly. And the most important part for me is that those outcomes may not align with patient priorities. So it's really important to know that in that core outcome set, the patients have been and their families have been consulted, and that there are outcomes that are important to them. And the research shows that when core outcome sets are co-developed, they do include more outcomes about quality of life and the measures that are important to patients. So next slide. I'm just showing you 6 of the pediatric rare disease core outcome sets that have been developed in Canada in the past 6 years. So 6 years, 6 core outcome sets. The pediatric anxiety is just starting now, and some of them are finished and some of them are just in the midst of wrapping up. Next slide, and this is the last slide. So I see a lot of key opportunities for patient engagement research. It's really a very favorable landscape. So there's the whole emphasis on learning health systems, and we're just figuring out how to do the patient engagement in that and how to get into that learning health system and make sure that that pillar that we have of patient families and communities is, as I like to say, part of the wobbly stool. It's no longer wobbly. The timing is there. There's organizations like OSSU that are going to support you, and there's lots of grants in that area. Of course, here you are, exactly the example of the support. So there's a lot of resources. There's a lot of people interested in doing it who want to share what they've learned. And actually, we're making some headway in measuring the impact. So that's always kind of lagged behind. And a lot of people are interested in evaluating what's happening, what impact it has on research. And that's a really important part of it too. So if you're planning a study, make sure that you think about the evaluation at the very beginning of the study and not as an add-on at the end. Oh, by the way, we should find out how well this worked. It should be in your planning. So I've been involved for 25 years now, and the last 7 years really heavily into the research, and I find it a very exciting time and very encouraging. And when I see a group of young researchers, early career researchers interested in this area, I think the future is in good hands. So I'll stop there, and I went a little bit over, but apologies, and hand it back over to Diane.
Thank you so very much, Maureen, for your reflections and insights and considerations. It's really always a pleasure to hear you speak, and we thank you very much. So my colleague, Rebecca Gannon, and myself will talk about the inception of the community of practice and some work that's informed how we got here and moving forward to really consider and meet the needs of early career researchers within OSSU and also beyond. Just let me forward my slide here. So in terms of the goals of the COP, or community of practice, it really did grow out of OSSU's early career researcher initiative. And we know that starting out as an early career researcher comes with a number of challenges and unique considerations, like identifying patient and community partners and securing them and within our research and partnering with them in a very genuine way, right? And sustaining meaningful engagement throughout the research cycle with our patient partners and community partners. Other challenges too are having to navigate the funding environment, right? And mentorship, all really while starting a research program in patient-oriented research. And, with the networking that comes along with that and relationship development, and as well as a number of other things. And at the core of these things is building knowledge and capacity for POR, right? And the how to go about it in terms of skills for POR practice. Yet, there was really no central forum for ECRs, who conduct POR or want to conduct POR. Although we're out there, right? And within OSSU centers and initiatives and also beyond. So the idea for the Early Career Researcher Initiative really, overall is to support trainees and ECRs to become POR researchers by maximizing training and capacity building supports that are offered through OSSU Central and its centers and initiatives that Hillary had up a little bit earlier. Each center, for example, has its own tools and resources around patient engagement and POR researcher training, for example. But also the creation of a community of practice, really as a forum for ECRs to come together within this kind of an environment as a central way of training and providing support to ECRs. And while doing so, also maximizing existing OSSU relationships and partnerships with other entities and organizations like AMS Healthcare that provides funding, for example, to support early career researchers. So stemming from the Early Career Researcher Initiative, why an OSSU Community of Practice for POR? Our goals are to support career pathways, right, through building and enhancing POR knowledge and skills within an integrated environment, and to cultivate a community of POR ECR researchers and a culture that supports that, where ECRs have a forum to share insight and tacit knowledge, and to develop relationships through networking, and to benefit from mentorship as well. And also, and really importantly, in Maureen, you had touched on this, is to position us as ECRs as the future, right? As future leaders within this community, and to connect you with resources and assets that are in the OSSU network as a capacity building strategy. And so our approach is to grow this community of practice by involving you as ECRs and enhancing your involvement in integration for those ECRs within our OSSU centers and initiatives and structures, and for those ECRs that are beyond the OSSU family. It is what our vision really is, and to enhance opportunities for our career development, because we really do envision this embedded, integrated core environment for ECRs, and with supports to enhance our skills and experiences, and facilitated by this kind of a community of practice. So we got to this point where we're at today, or to create an effective community of practice. What we did is we started with a needs assessment by sending a survey to our OSSU centers and initiatives, and also to those ECRs that are attached to OSSU centers and initiatives, to get an idea of our OSSU ECR environment. For example, to understand where ECRs are situated, what their roles are like the kinds of research activities that they're involved in, including leadership roles, which is really important for our future as ECRs, right? Also your needs and priorities, and gaps that we can target moving forward with this community of practice. And that's built around you, right? Built around us as early career researchers, and to meet the needs, to meet our needs. And from the responses from the centers, so we did get some responses to our nice responses for our surveys that we sent out. Most centers and initiatives that responded do engage ECRs in center activities, and also on mainly, I might be able to say, on working groups such as equity and anti-racism working groups, on patient engagement and knowledge translation working groups. And as also a main response was engaging ECRs as casual research associates and coordinators. Some ECRs are also currently engaged in leadership roles, a scientific director, for example, of a center, or involved in a center's governance in some kind of way. And that there's also opportunities for ECRs to be involved in leadership, which is really very encouraging for us. And also you'll see here on the slide that centers use a number of different ways to support and engage ECRs, such as providing mentorship and orientation to new ECR members, the provision of leadership and EDI, or equity and anti-oppression training, in infrastructure, core staff, and admin support, sometimes for unfunded ECR projects, but also in general, and financial support for things like equipment and software and scientific meeting attendance, conferences, in other words. And centers initiatives also communicate training opportunities. This was a big one as well, such as upcoming webinars and opportunities that ECRs can get involved in. We also wanted to know, okay, what enables, what facilitates or hinders the engagement of ECRs on the part of centers and initiatives, with the main enablers being funding stability. For example, funding programs that are in longer cycles of funding, such as in a 5-year cycle of funding, really allows programs to build trust and collaboration among its members. And with this kind of stability, with a broad network of collaborators, some centers have said that this really helps to support ECRs and their career growth. Other centers have also reported having an engagement fund or dedicated monies that can kind of work as a platform, an incentive for meaningful engagement, conversations, and supports within a meaningful environment for early career researchers. Which brings us just briefly to some of the other main enablers, such as tailored mentorship strategies and regular meetings with or involving ECRs, which can be very effective and responsive, right? Specific and responsive to the goals and contexts of ECRs, or serve to support ECRs within a broad network of collaborators if ECRs are engaged in, say, regular governance meetings, for example. And then also opportunities for embedded worker fellowships where ECRs are embedded within an OHT, for example. This has really served to engage ECRs by having them right within the health system context. Some barriers, here we have, of course, on the other hand, some challenges to engagement. It was recognized that ECRs with academic or other appointments face a lot of pressure, right, with workloads and having to produce specific academic outputs, and also be involved in administrative work to varying levels, of course, but which really serves to hinder engagement in OSSU centers and initiatives, along with things like a lack of institutional or departmental support, and which may directly or partly explain the next point on communication and reach, which was mentioned as a barrier. With the barrier really being that a substantial portion of ECRs aren't aware of the services and supports available to them through OSSU, and that they can engage with centers and initiatives as needed for help and support. And then we have our practical issues of lack of time, right, to engage ECRs and little funding for research and projects that ECRs can get engaged with. And these were also reported as barriers. What did ECR say? Okay, so to better understand their needs, we did send a survey to them as well, which is really very helpful in terms of what they provided us in terms of their responses. We wanted to know about things like their research expertise, how they're involved within their affiliated centers, and what their experience with POR is. And we found too that most ECRs were affiliated with a center initiative and involved mainly in research projects, research activities, which aligned with what we were hearing from the survey results from the centers, with fewer included in leadership and governance, but with almost half being interested in leadership positions and in governance and that sort of thing. So that was really encouraging. In terms of areas of expertise, most of the expertise you'll see here in this chart on the slide was reported to be research methods, qualitative, quantitative, followed by health systems research expertise, data platform and analytics, knowledge translation and implementation, and then fewer reporting expertise in things like clinical trials. And you'll notice here, second from the bottom, patient engagement practice, and then also patient engagement, the science of patient engagement, weren't endorsed as highly as some of the other areas had been, which really does reflect, though, when you look at the totality of it, a breadth of expertise. However, when asked about level of experience with POR, half rated themselves or considered themselves to be a beginner in terms of their level of experience with patient-oriented research, and not even half as intermediate, and only one reported being or having, some advanced kind of experience with POR. And only half have received training in patient or community engagement or POR. And many or most were not connected with any POR training programs whatsoever. And Rebecca, maybe I'll call on you to hop in for our bit of interactive piece here. So, on the one hand, this is, it's nice to see the breadth of experience, but then we're not seeing ECRs connected with any training programs. I'll hand it over to you, Rebecca.
Okay, terrific. Thanks. You were on a roll, Diana. I was seeing we have less slides left, but that's okay. So thanks so much. I think one of the things I wanted to say was I think what we've done as a group, Diana, Peter, and I, is really look at what we heard from the ECRs. I just want to say we heard from just under 20 people in terms of ECR. So it was great to hear from all of you. There was that variability in experience. There was also some variability in terms of the roles that people were working in within as an ECR. Some were in their first independent appointment, and others were working in other capacities. So I just wanted to share that. Before, what I'm going to do is I'm actually going to go through the next couple of slides, but you'll see there are some prompts on each slide that I want you to start to think about, and then we're going to have a little bit of a Menti meter, but we'll go through these, these few slides first, and then we would like to hear from you a little bit, because we know that the people that we have in this virtual room today, it's actually a larger group than we heard from. So we'd like to learn a little bit from you and hear about, like, who do we have here, and do these things resonate with you? Are there other things that we need to understand? So there'll be some quick sort of checking in to get a sense of who we have in this virtual space. And then from there, there'll be some questions with some feedback for us that will help to drive our activities over the next 6 months and an in-person event that we're planning in the months to come. So I don't think I have control. So if you can advance. So the other things that we heard, and you can see that it was similar from the centers in terms of what we heard from the centers or initiatives compared to the ECRs themselves answering the questions. So limited or lack of funds were one of the biggest things that prevented people from engaging in patient-oriented research. Our early career researchers identified that access to patient partners was a bit of a challenge for them. How do we find the right people? How do we engage them? How do we reach out to them? For some, probably for many, although some identified limited or lack of time, but people were looking for things like skills in conducting POR, mentorship, network building, and resources. A little bit fewer in terms of resources. I think there's, maybe some broader understanding of the resources available, but wanting some of that tacit knowledge to kind of really understand, how do I go about building my program of research and patient-oriented research? And you can see that below: peer networking, training opportunities, mentoring, and networking. So those are some of the things that we're hoping to do through this community of practice. If we can, and we want you to think about, are there additional barriers from your perspective? If we can go to the next slide, Diana, please. And the opportunities for skill enhancement. One of the things that was really important to ECRs was thinking about building and strengthening connections. So in addition to, we just talked about patient partners and being able to identify and engage patient partners, but a really top priority was also strengthening connections with other knowledge users. So with health system stakeholders like policymakers, like organizational decision makers, how do we start to build those relationships and negotiate those partnerships and agreements? So that's a piece that an opportunity for learning for many. There were many who identified that they'd like to expand their knowledge and skills related to patient engagement, science, practice, and strategies, and others who were quite interested or additionally interested in community engagement, science, practice, and strategies. So thinking about those uniquely, and then thinking about research impacts. And those impacts, not only on the people, the patients, the people with the lived experience that we're targeting, but thinking about those impacts on policy and decision making. And that really connects with that idea up above. Thinking about those engagement impacts. So I think, certainly appreciating the narrative about how do we demonstrate the impact of that engagement, of having patients as part of our teams, and being able to really talk about how they've changed, sort of the thinking, the questions, the methods, all of that, to capture some of those things. Certainly many were interested in advancing EDI and thinking about how to meaningfully integrate EDI into their work. And then, as Maureen touched on and Diana touched on, I mean, there's a knowledge gap amongst ECRs around learning health systems and access and use of data platforms as well. So we'd like to hear in a minute about what our highest priority things for you, and partly trying to help inform what it is that we create for that in-person event that we're planning in June. So if we can go to the next, Diana. So the last thing that we wanted to say, as I mentioned, those two things, we want to foster virtual connections. So in the next 6 months or so, we envision that this community of practice will continue to be a virtual platform, a way to connect together. And then we plan for an in-person event in June 24. And we'd like to understand, how would you like to be engaged in the community of practice? What would keep you engaged? What would be a value producing in-person event? Because I think what we don't want to do is just add to people's already existing pressures, but we want to think about meaningful opportunities to build this community of practice. So maybe I'll just have you stop sharing for just a minute, Diana, and fingers crossed this works out, everyone. But I am going to just share. And you can let me know if you can see it, and then I'm going to present it. And for those of you who are on the call, if you can join us at menti.com using the code at the top, or you can use the QR code at the bottom. And we'd like to hear from some of you, because I know many of the names are familiar on the call, but not all of them to me. And so we'd like to get a sense of how many of you, for how many of you this is the first time attending an OSSU event. And some of you may think, oh, okay, well, maybe I'm part of a center initiative event, but I haven't really done something through OSSU Central before. So, okay, so we've got lots of first-time attendees. That's great. Just going to give people another minute here. Okay, terrific. Welcome to all of you. Thanks so much for joining us. Really happy to have you here. And really excited to be really launching this community of practice. I'm going to just advance here, if it's okay with everyone. If you didn't answer, you'll have a chance to answer some of the next questions. So how would you rate your level of experience with patient-oriented research? We know from the survey, about half of the people we heard from rated themselves as beginners, some rated as intermediate, and only one sole person felt like their skills and knowledge and competencies were quite advanced. So, and it seems like we've got a similar mix in the room today. So that's great. Thanks so much. And I'm just going to advance this again. So what barriers to patient-oriented research do you face? This might take people in a little bit longer because it's sort of more open-ended. So we'd like to hear from you about some of the challenges that people face. They may be the challenges that you've heard, that you saw on the screen, or you may have unique challenges that you face in terms of engaging. Okay, time, identifying patients, money, some early ideas. Okay, I'm just going to give you another maybe 15 seconds or so to put those ideas in. Okay, so these are really helpful for us to think about things that might be useful for people. Okay, I'm not seeing the words moving around anymore, so I'm going to go to the next. But you can continue to add to it. I have left it open for the next 7 days, so if you think of things afterwards, you can continue to add. And then what are your highest priorities for enhancing your patient-oriented research, knowledge, skills, competencies, anything along that front, your experiential knowledge? And I see one of the things that someone put up was co-design training. And it's interesting because of the people that we heard from, the respondents to the survey, only half had participated in any kind of formal training or support program. So that's interesting to see that coming through again here. Okay, I'm just going to scroll down because we have some more ideas there. So gaining experience, supports to transition out of a trainee role. Great. Excellent. Okay, I'm just going to give another 15 seconds or so. Okay, this is terrific. Thanks so much for all these ideas, everyone. And I'm just going to stop sharing there. So this is really all very helpful. I am going to turn it back to Diana. We're going to take that away, and then we'd like to hear further from you. We may reach out as we refine our plans, and we're hoping that we'll use that information that you've just shared with us to help us to develop our plans into something, a vision that we can all get behind, where people want to be connected and they find it good use of their time, and it actually helps to advance them in terms of becoming a patient-oriented researcher.
Thank you so very much, Rebecca. That was absolutely wonderful to see all of your responses. What I'm going to do now is I'm going to turn it over to Dean Ferguson and to speak about methods development and support.
Great, thanks, Diana. We'll advance the slide there.
Oh, and I went one too far on you, Dean. Let me go back. There you are.
That's okay. They know who I am now. And yeah, so I'm going to talk about the method support offered through OSSU and its centers. So next slide. Yeah, so as I mentioned in my sort of intro remarks, there has been this global shift of conducting how we conduct clinical research or clinical and applied research, health services research. And you know, team science is becoming the norm. The multiple disciplines are required, along with knowledge users, decision makers, policy makers, and patients, and patients broadly speaking. And I just can't emphasize enough the importance of embracing this team science, and partnered probably with that integrated knowledge translation by bringing everybody, all the partners as part of your research team. You know, funding is made much easier when you embrace those components and come with a team science approach to your projects. And along with that team science is just the difference in our approaches to research, such as patient-oriented research, consisting of, you know, pragmatic trials, big data, or real-world data projects, patient-centered outcomes, a greater integration of EDI principles, not just within the research team, but within the research design and execution. And this global shift was started largely in the UK with Involve and the National Institutes of Health Research, originally Involve, and now it's under the NIHR initiative of patient-oriented, patient and public involvement in research. And then that migrated to the Patient-Centered Outcomes Research Institute in the States, which is a very large, well-funded institute that was born out of the Affordable Healthcare Act, President Obama's Affordable Healthcare Act, and between PCORI and NIH and Involve, they were kind of leading that global shift. And here in Canada, we developed the strategy for patient-oriented research. And here within Ontario, we were one of the SPOR, sort of the SPOR support units that were funded as part of that national strategy. So drilling it down to Ontario SPOR Support Unit, what can we do to support patient-oriented research? Next slide. Well, part of our mandate is to transform health and health service research in Ontario, as Hilary mentioned. And to do that, we do it by embracing patient-oriented research approaches and supporting the uptake of health and health services research evidence, so that knowledge translation and implementation research. And so our methods and our method support is a key area across our 14 OSSU centers. And this method support comes in 3 different sort of parcels: traditional research method support. How do you design a trial? How do you analyze an observational study, et cetera, both quantitative and qualitative, but also specifically patient-oriented research method support, so pragmatic trials, et cetera, patient-centered outcomes. And then finally, patient engagement science, because we also need to advance that field of how we engage patients and meaningfully and appropriately. Next slide. So I'll start with that patient engagement science. Over the last certainly 10 years, and certainly within OSSU, we've seen that we've moved from why are we engaging patients to the how do we engage that patients, so that again the science around that how offers a lot of opportunities for researchers and early career researchers, probably in particular, about studying the best practices. How do we establish best practices? And we do so by creating that evidence base. So plenty of opportunities in PE, including equity and diversity, compensation, measuring impact. How do we ensure meaningful patient engagement, et cetera? Those all offer sort of patient engagement science projects to sink our teeth into. And we also have to match that with the need to measure and appraise patient engagement in research activities. So taking audits and surveys or scoping reviews of the literature to get a good sense of what the patient engagement activities are. And so to support those type of activities, certainly engaging patients is critical. We also want to include them in those projects. And you can do so by working with the OSSU centers and our initiatives. I'll get to that on the next slide. But I would very easily say that all our centers would be more than happy to advance some of those projects. Next slide. Thanks, Dan. So accessing the broader method support, not just patient engagement, but patient-oriented research and sort of traditional designs. The easiest way is through our coordinating center, but also our website, which provides some very in-depth description of our centers, as well as points of contact, their websites and materials and resources as well. And OSSU Center also can direct you to our individual research centers. So next slide. So when I mentioned, the reaching out through OSSU into its centers, here's an overview of our what we call our resource and service matrix. So on the left-hand side in the green is each of the 14 centers, and below that in the dark green is our major initiatives, including training and capacity building initiative, which this community of practice falls under. And at the very bottom is our coordinating center, which is our anchor for OSSU in the province. And so that's on the left-hand side. And across the top, you can see the various areas that they can offer method support and methods and other support to our research community. So if you take the third one, real-world clinical trials, you can identify the various centers, and including the coordinating center, they can provide guidance on real-world clinical trials. In the second one, sort of general methods support and development, again, where to go within the province to gain that expertise. And we're there to help. That's the important message, that please reach out and we can match you up and engage you with the right people and right expertise. Next slide. So as one of the 14 centers within OSSU, I thought I'd just give you a quick snapshot of the Ottawa Method Center. And fortunately, Sue is going to follow me with her center, the McMaster Collaborative for Health and Aging. But I'll focus on the Method Center. So the Method Center here in Ottawa, created about 17 years ago, and we were there to enhance and enable research with our institute, the hospital, and the University of Ottawa. And like I say, it's designated as one of the 14 centers within OSSU. Next slide. So our role in Ontario SPOR Support Unit is to provide that expert methods consultation to any provincial researcher, so not just in Ottawa, but across the province, just like the other centers, and provide method support and development as well in terms of sort of the methods and the science of patient-oriented research, and to partake in capacity building and mentoring. Next slide. So within the Method Center, we have these sort of 9 buckets of areas of help. And so all speak to general methods in particular, but all are well equipped to talk about patient-oriented research. specifically to address patient-oriented research and patient engagement. We've created the OPERA office, which is the Office for Patient Engagement research activities within the institute and the hospital, and they have specific expertise in the area of patient engagement research. So any of those areas that we'd be more than happy to help researchers within the province, and today focusing on early career researchers. So feel free to peruse our website and certainly reach out to myself. And next slide. And so just to give you a couple examples, we've of our early career researchers that we've helped here locally. Innie Chen is a young obstetrician gynecologist that was doing a bunch of work during COVID, and we partnered her with our patient-oriented research methodologists to bring in knowledge users, to bring in patient advisors, to help her with a couple of projects from consensus building, Delphi techniques, all the way through to a more of a quality assurance or quality improvement exercise of creating a dashboard for pandemic women equity reporting dashboard within the hospital. And so the Method Center spent a lot of time with her, getting her research protocols in line, as well as the execution of those. Next slide. Another early career researcher, Terry Ng here, was doing a large trial, patient-centered trial, looking at whether a single dose versus multiple dose of pegfilgrastim would do. So very, again, patient-centered question with patient-centered outcomes. And we had two patient partners involved in his project, and they provided input on outcome measures, development of a daily a bone pain diary, the study protocol, developing consent forms with the investigative team. And so this was very successful locally, and hopefully we'll be able to expand this trial out across the country. So next slide. Yeah, and to sort of address what Rebecca raised is, I think it was opportunities for skill enhancement, some of those areas of just general method support. You can reach out across those centers, those are 14 centers. I've just highlighted a few here. So ISIS, we've developed this data, helped them develop this data analytics services, the DAS, for public sector researchers that enhances and creates access to data a lot more efficiently and brings the right expertise on board. Within Clinical Trials Ontario, not necessarily a method support directly, but certainly helps us indirectly, is developing that single point ethics review for across the province. The Women's Exchange at the Women's College Hospital, developing sex and gender analysis tools. They also offer consultation, and in terms of those tools, they've got a brilliant set of resources there on their website that early career researchers can use. The Ontario Child Health Support Unit, OSSU, also offers a wide range of supports. And Diana's group at the Center for Rural and Northern Health Research, Craner, also a bunch of supports in rural and northern health and Indigenous community health as well. Next slide. So many on those sort of opportunities for skill enhancement address how do we reach the decision and policymakers and other knowledge users. I've identified, certainly our OSSU Coordinating Center can help with that. I've identified the other centers that have made great inroads there. The Institute for Better Health at Trillium, based at Trillium, the Master Health Forum, Knowledge Translation Program based out of Unity Health, and the Ontario Drug Policy Research Network. Again, look them up, and if you need to access them, please do, and you can do that again centrally through OSSU or just reaching out to the center directly for help. Next slide. And that's it. I'll turn it over to Sue, and Sue will tell us a bit more in depth about her center, the Collaborative for Health and Aging. Sue.
Thanks so much, Dean. So I'm really pleased to be here to share some of the activities of the McMaster Collaborative for Health and Aging. And Rebecca here is not just a co-lead of the Early Career Research Initiative, but also a co-lead of the Collaborative for Health and Aging. Next slide, please. So as Hilary and Dean mentioned, the McMaster Collaborative for Health and Aging is one of the 14 OSSU research centers, and we're a coalition of researchers, trainees, older adults and caregivers working together to improve the health and well-being of older Canadians, specifically by advancing patient-oriented health research on aging. And while you'll see aging and older adults in many of our resources, even if you don't identify your work as aging specific, I hope you'll find value in them. And I think this is the case for other OSSU centers and their resources. And for example, I've recommended the Porch modules, which are done within the context of children's health to aging focused researchers. And I think they're really great. Next slide, please. So we were asked to share some of our experiences as early career researchers or trainees. And this is what I would say my formal training looked like when it comes to community engagement or partnering with those with lived experience in research. I did my PhD in a research methods program, and I don't remember a single course even talking about partnering with people with lived experience. Next slide, please. And a few years after I finished my PhD, I started working at an HIV hospital, leading and facilitating research and as a member of the hospital leadership team. And well, I would say I learned by fire there. And there were, really strong advocates, people with lived experience and incredible dedication to changing how care was provided and what and how research was conducted. And I really want to thank them for teaching me kind of fire and all. We had meetings that would be stopped by people with lived experience, reminding us that, maybe we didn't do a safer space acknowledgement or group agreement statement at the beginning. I had a peer researcher say he was going to step away from a project if we didn't ensure that all research participants were offered to be interviewed by someone with lived experience. I've had a whole team demand double the honorarium that we had budgeted for in our grants. And, with this fire came incredible learning moments and feelings of connection and meeting. Next slide, please. And another piece of my experience that helped shape our direction at the collaborative are the friends and colleagues that have had to dig so creatively to pay honorariums or not do the work in partnership at all. And I really think that isn't right. Next slide. So in this presentation, I'll provide a few examples of tools and supports that we've developed to build capacity for patient-oriented research in aging, all of which were developed and operate in partnership with older adults and caregivers. And I have QR codes on the slides where you can access these tools and supports. And if you're interested in learning more about our co-development process or have any feedback, I encourage you to reach out. Our first tool is next slide, please. Thanks. A partnering principles and strategies guidance document, which was first created for our own members, but then rewritten to share more broadly. And to Maureen's point, it's so important to be on the same page. And it was really developed to ensure that members were approaching partnership with common principles and language, but also to encourage some consistency in activities, specifically to the steps of recruitment and orientation and meetings with older adults and caregiver partners. So for example, having those individual conversations during the orientation process with new partners, including discussions of their preferences for communication, their comfort with technology, and any supports that they might need. We then built from this guidance document and created more specific supports and tools for those who are new or newer to this work. And Yeah, next slide, please. This fellowship that I'm sharing is specific to those who work within the aging space, but it's one of the initiatives that I'm most passionate about and think can be really impactful for filling in, my blank slide of my experience for others, but also addressing some of those barriers that I think were identified both in the survey and then in the Mentimeter that Rebecca just did. And this fellowship provides both financial and experiential support throughout the process of imagining, planning, and conducting partnered work and in a meaningful and supportive environment. So, for example, we designed the application form and process to help trainees think through the critical pieces. We refer them directly to other resources such as the OSSU Fairness is Excellence framework and the CIHR guidance on compensation. And before they even apply, I meet one-on-one with each potential applicant and talk about feasibility and potential ways of partnering. And we also have trainees, older adults, and researchers on our review committee, and we're committed to providing constructive feedback to applicants regardless of their success with the call. Next slide, please. I don't have time in this presentation to highlight the role of our older adult and caregiver partners in any detail, but here are a few quotes of two of our partners who've been involved in this initiative. And on the next slide, we just have a quote from one of the trainees who went through this program speaking about the impact on him. And this leads me to the next resource, and this is a workbook that we designed to guide and while we say trainees, it's really for anyone, as I said, who is newer to this work, and to guide in the planning, the conduct and follow-up of engagement meetings. And it was based on our experience supporting trainees in preparation for meaningful, but also mutually rewarding meetings with older adults or people with the relevant lived experience. And the experiences from all three of our member groups, so researchers, trainees, and older adults, were used to provide questions and propose reflections. And the next slide has a screenshot of their workbook, and it's available free for anyone to download from our website. And it's a Word document, so you can edit and add, make it your own. You can take out all the older adults and Control F and replace with whatever works in your own work. And on the next slide, one of our very organized trainees, for her own purposes, wanted to create a document informed by our workbook where she could record her actions and lessons learned from each meeting with partners. And as someone who always thinks I'm going to remember like who went to which meetings and which resources I sent out to the team afterwards, and yet a month later cannot remember, I thought this was a great idea. So this meeting planner is a companion piece to the workbook that follows along with its sections to help trainees apply the ideas and principles. And on the next slide, I have a screenshot, and it has sections for the planning, the recording, and the reflection that can be used to keep records of the engagement activity in a useful way, but also hopefully helps people build and learn from their own fiery moments, because surely there will be some along the way. And these are a few of the tools. We also have some opportunities for trainees to come together, or for any of our researchers and members to learn. And as Diana and Rebecca were referring to, is like building that tacit knowledge, really sharing and building a culture where this is work is done well. So I just want to end by acknowledging all the members of the collaborative who helped in the creation of these tools, and I invite you to reach out. Thanks very much.
Thank you so very much, Sue. Excellent resources and supports and examples, and from your own experiences as well that you shared with us. Thanks very much. I'm now going to call on Francine Buchanan to speak about patient partnership, what that looks like, and some examples on her end.
Hi, everyone. My name is Francine Buchanan. I am part of the Ontario Child Health Support Unit. So I support researchers and here at Sick Kids, but across Ontario, we're focusing on child health research. But just like you, I'm an early career researcher as well. And in my training, I actually didn't have any training in patient engagement, except when I was tapped on the shoulder as a patient partner. My son is a child with medical complexity, and often I was reached out by researchers to say, hey, can you let me know your insights on this or insights on that? And that was my pathway into understanding more about patient engagement and meaningful patient engagement and what it means. So everything that we do here at the Ontario Child Health Support Unit and in the patient engagement and research program at Sick Kids is informed both by my experiences as a researcher and my experiences as a patient partner. If you go to the next slide, we've seen this comic already, but I want to thank Maureen for sharing with me a few years ago. But I want you to look at this comment a little bit differently. And I want you to think about what it means to actually get the perspective of that baby. If you were to ask the baby to explain what they see, first of all, would you believe them? And secondly, would you actually make the changes necessary so that the perspectives and the view and the mobile works for all of you? Then finally, how are you going to go make that change? Are you going to take all the information that your baby told you and then go off into the back corner and fiddle with that mobile yourself? Or are you going to work collaboratively back and forth, sharing information about what you tweaked, what you looked like, and do that together with the baby? I love this comic because it makes me think about that. And that, how you engage, what you ask, what you do is what I'm here to help you with the Ontario Child Health Support Unit. So go on to the next phase. When you do get training on patient engagement, it tells you that everything's a spectrum, right? There's multiple ways to engage. You know, the academic science tells us there isn't just one way to meaningfully collaborate. But when I look at this, I often get confused and say, so what does that mean? What do I do? How do I understand where I fall in this? And how do I understand where I sit on this arrow? So if we go to the next slide, I'm going to kind of explain it to you as a little kind of story. So if you think about it, when we think about where we want to fall on that spectrum, I like to relate it to if you've ever been asked by your significant other or friend what you want to do for dinner tonight. And there's usually about 3 different ways that this conversation has go. First, they might tell you that, you know, they might say, I don't feel like pasta tonight. How about we order dinner? And in that sense, you might feel like you don't even have a choice, right? They kind of told you what it is, but you don't know if you can actually afford ordering pizza tonight. And you kind of did feel like pasta. So in that example, you're like, I don't really know how I feel. Am I really a partner in this situation? The other situation might be that they want you to do all the thinking, right? They want you to think about what's in the fridge, how to prepare it, how long it's going to take, and they just throw out the question, what do you want for dinner? They don't want to put any thought into it. Or the third way could actually be someone who wants to have a conversation about it. Talk to you about if you can both afford to eat out, and if not, what's actually in the fridge, how long it takes to prepare, and maybe talk about how you can share the load. I like to tell this story because I like you to think about, honestly, how you would feel when you're asked this question, because everyone's been asked, but also how do you feel when you ask that question? Are you looking to just offload some of the work? Are you looking to really gain a perspective, but you don't have much time to actually do the collaborative work? You just want to take the information and go and make it on yourself. These are all the questions that we ask when we're trying to do engagement. So we go to the next slide. There's not right or wrong. Each one of those 3 examples we gave are just the ways that we're feeling that night when we ask for what's for dinner. It could be our workload, our capacity. It could be the brain space that we have that night. It doesn't matter which one you end up with. It's being transparent with your patient partners on what that is. So what I ask of people is to think through why they want to engage, how they want to engage, who they want to engage and what they want to engage about. And it makes you put yourself into that role of how would I feel on the other side of that conversation about what we want for dinner, but also that we reflect on those things so that we can be transparent with our patient partners about it. It also means that we can actually engage them meaningfully. So if we go to the next slide, what we're trying to avoid is this. We go off, we do all our work, we put something together, and then we throw it in front of them and say, what do you think? This is the tokenism we want to avoid when we're engaging patients and families. We go to the next slide. So the idea is to plan. And what we do at the Ontario Child Health Support Unit here at Sick Kids in the Patient Engagement and Research Program is support you in thinking through these questions and helping you plan. There's so many different ways you can engage patients. There's so many different ways you can engage across the timeline of your project. It is a confusing environment that we can support with education and training, but we really support by getting in there with you and tackling the questions that you have. Next slide, I'll help you understand the multiple different ways that we support you to engage. So we can help you by getting input from partners at the beginning of your study, very low barrier to entry. We have the Research Family Advisory Committee, an already established committee that is experienced in this, consists of patient partners and staff at Sick Kids, researchers, research support staff, early career researchers, and they can help you walk through the challenges that you might have, give you some foresight on where you're going. Go to the last slide. I think that's my last slide. So in addition to these resources, what we always ask our people to do is we direct them to the PORCH modules, Patient-Oriented Research Curriculum in Child Health. This gives you the foundation of how to start reflecting. And then go to the next slide. They're short modules, about 20 minutes each. You can do them on your own time, not a problem. Once you have that foundation through the PORCH module, which is a fantastic training module, we can then support you how you work and what your needs are. So if you do want to do patient engagement, you just don't have the time and capacity to do it, we have patients that we can partner you with to do document reviews. We'll support how that goes. We'll summarize the feedback and provide it back to you. Then we also do the consults to find out how we can actually support you along your entire projects. You might consult with the Research Family Advisory Committee early, or you might go and consult with them at different stages along your study. We do training and education, so we can customize training for your team if you want your team to support you in doing the engagement work. We have advisors that we can match you with, so family advisors. We can support you in how to evaluate your work. And mostly what we do is sit down with you, understand your specific needs, and help you figure out how you can design your research so that it meets your needs, your capacity, and most importantly, the needs of your patient partners. You can reach me again from anywhere across Ontario where you're doing child health research. You can email the askcrs@sickkids.ca. You can reach out to me directly, Francine Buchanan at sickkids.ca, or you can reach out to OSSU or OSSU as a central coordinating center. That's it for me. I'm going to hand it over to Peter now to sum things up for us.
Awesome. Thanks. Thanks so much, Francine. And thanks so much for everyone for the excellent presentations. I think we had a really nice overview of different perspectives and support. I was going to mention a few sort of examples of my experiences, but I think in the interest of time, we want to just have an opportunity for people to ask questions and sort of, because our goal really here is to help you and help early career researchers. So I'd like to open it up. I mean, I think we've had lots of I think some of the takeaways I have from today is, the importance of really just reaching out with questions, and that OSSU and the different affiliate research centers are really there to support individuals in Ontario doing research. So very much reaching out with questions, and there always isn't answers, but they'll put you in touch with who can help you. So with that, we have about 10 to 12 minutes left. I don't know if anyone has any questions. Feel free to put some in the chat if you want to, or just to feel free to unmute and ask yourself here. Maybe one thing to get things started, to Francine. So you had mentioned some of the resources for at sick kids, but for someone that isn't at sick kids, you know, can they similarly just sort of reach out directly and get help? Is that still sort of a place that OSSU can help?
Yeah, my mandate is to support across Ontario, but we also have at CHEO, I have a colleague, Kim, who is also in the same role embedded at CHEO, who can support you with how CHEO works in terms of engagement, can connect you locally with CHEO advisors, and can support you with their patient and family advisory committee as well. So right now, OSSU supports locally at CHEO and sick kids, but our mandate is to support across Ontario. The other thing that we do is to support in terms of getting publications out or grants out that might be for collaborative work that's happening across different institutions. So we can help support with how you write your grants, how you do your project plans, how you do your engagement plans, and then any publications that you want to build out of that work that you're doing.
Okay, that's great. That's really helpful. I don't know if anyone else has any questions, can put in the chat or put a hand up to ask.
And maybe I'll just jump in, not with a question, but also to put out to the group. You may not have a question, but you may have ideas about what else might be useful to you, you know, or if any of the speakers, we've heard from a lot of people today. I think there were lots of terrific insights. So these questions could be directed to any of our speakers, except for Dean, who's had to go to a different meeting. But otherwise, for anyone who's on the call, we welcome you to offer feedback or comments or questions.
Yeah, I think it's Aya, if I'm saying that correctly. Go ahead.
Hi there. I really wanted to turn my video on, but it's not working, so it's just my voice. I don't have a question, but I just wanted to say that this was so helpful. It really laid the foundation for my understanding of patient-oriented research, so I really, really appreciate it. I think once I kind of sit with all of the things I was presented with, I'll probably have questions then, but I can't think of any right now. But great info. Thank you.
Good, that's really helpful. No, thanks so much. And part of it, I know when I was starting, it was hard to sort of get my head around what's available and what supports are and what's so. But I think hopefully this gives some sense of it, and it's only a snapshot. And we hope that we're having an in-person session too later in June will really help to bring some of these resources together and help to be able to individualize help for individuals with their projects and their careers. Any other comments, questions? I guess maybe one question I can have, or sorry, Shelley, go ahead. Yeah.
Thanks. Thanks so much for this workshop. It was really great to hear about all the exciting things that are happening. I just wonder if there'll be future opportunities to continue to sort of co-envision that in-person meeting that you're planning, or what that looks like, sort of the ramp up to that.
Yeah, for sure. So it's we have a date and a venue roughly, but there definitely will be a lot of opportunities. And partially it was sort of this was one of the first stages to receive feedback and ideas about what that should be focused on based on needs and resources and questions. But certainly we can connect after, Shelley, and if others are interested in providing feedback around developing what that program is, we're certainly open to that. Was there anything in particular you wanted to mention or bring forward just about something to focus on or a theme?
I guess I just had an idea offhand that just sort of as we think about, okay, we're early career researchers, you know, we're going to be in this field for a while, presumably. And as we really have an opportunity to sort of shape the culture and how sort of the bar is set for patient-oriented research and patient engagement. I just wonder about also including patient partner leaders sort of at this stage alongside us. I was actually having a conversation with Maureen this week, chatting about how there's only one of her and she does her many roles so well. But I think there's a real need to also start to widen that pool of true patient leaders in the field who really have an understanding of patient partner leadership and empowerment, and really bring them to that level of the spectrum. So I wonder if it makes sense to sort of tie in a group of patient partner leaders at this stage, so that we can kind of learn and develop together, knowing that, you know, it will be partnerships going forward.
Mm-hmm. Yeah, that's a
Peter,
great
I have two
suggestion.
questions for you at this stage.
Yeah.
Are you planning to set up a community of practice, ECRs, as a sort of a working group, not just towards June, but further than that? Are you planning on a working group?
Yes, so that's a great question. So part of it was trying to understand, you know, everyone's needs and commitments and what's the best utility and usefulness. And so what we had thought, and I think
A small group.
and I think many of us, yeah. So I think many of us, I think particularly as ECR, you know, have lacked that sort of in-person mentorship and support and career development. So we really wanted to focus on that, particularly as a first step, as an in-person, and then from that, I think identify more sort of specific needs around that. But
Yes.
that is part of it. But I think we really want to your point, Shel, like to actually have this very much individualized and focus on individuals and career and mentor, because that's, I think, what's really challenging.
Yes.
A lot sort of distributed virtually. It's not as much as individuals. That's, I think, so I think the hope is from that we'll have a good group of individuals and then can work forward with there. I don't know about Janet, Rick, you want to add anything to that?
And regarding Maureen, well, there's only one Maureen. We've scouted the whole province. There isn't a second, because her knowledge and her breadth has been cultivated, as she keeps saying, over the years, not just with the SPOR program. So, but we will try and find leaders, as you say, through our centers and others, and make a core group available to early career researchers for guidance and mentorship.
And maybe one comment, and Francine can, because I think that this is, I think you've touched on an important, that there's sort of a capacity challenge in terms of that there's a few that get asked to do a lot, and part of it's around supporting career development for patient partners. And I know, Francine, you want to mention, because that's, I know, a lot of what you're involved in, as well as building capacity from the patient partner perspective as well.
Yeah, what we're looking at here at SickKids is how we can provide a pathway for patient partners to actually develop their expertise, but then be able to use it strongly with other people. So that is work going on in the background. A lot of that is funding. A lot of that is opportunity and making sure that we can connect the patient partners with the opportunities. So maybe by June we can share some of that stuff and bring some of the people that we have brought through this program that we can actually support with.
Okay, great. So we will scout all our centers, Peter, and make sure that we make some senior leadership in patient partnership available for June.
Mm-hmm. Yeah.
And in the space of child health research as well, there is the family engagement in research course. It's targeted at parents or caregivers, but they have now added a leadership stream. So after the initial family engagement and research course, you can now apply to take a leadership course as well. Again, along the same ideas of developing family partners and leaders.
Great.
Yeah, I can just add to what Francine saying. We're very aware of that, and we don't like that situation. It's not something that we want. And to knowing, and like often I'll suggest a second person, or for example, patient partner working group. We had a vice chair who was in a mentorship position, trying to bring people along. I do a lot of work in rare disease, and I think Francine can probably identify with this, but we work with parents who are caring for children with very complex needs that take a lot of time. And so we also have that issue of often they want to do it and they're very capable of doing it, but their child ends up in the hospital or something goes wrong in their care and they have to take a 6-month break, and we try to factor that in, but it makes it really difficult. Probably have that similar situation maybe in some of the aging research, that people, you know, don't feel well, or they get a, you know, they have a heart condition or something that exacerbates. So it's like we have to think of all that too, that it's not just that the people don't want to do it, it's that they may find it difficult to integrate that with all of the care that they give, or in our case, with our youth, for infirm rare, they have very serious medical conditions, and we have to be, you know, attentive to the fact that sometimes they need to take a break, or they just can't attend a meeting because they're not well. So it's not, I don't think it's a lack of willingness. Sometimes it's and a lot of it also is in who we're attracting and how we're recruiting and what we're doing to make sure that we have a diversity of people, and that's a big challenge too, and working on that. So yeah, it's a good point.
I've known each other for a while, and we've always said we want to open the door for the next generation of people that are doing it. I hate to turn down opportunities because I don't know if someone else is going to step into that space or not. But I think the other thing that we have to be very considerate of as our early career researchers is that these are people that are doing this not as a career trajectory. So, you know, there are people that are, I am one patient partner who turned it into a career trajectory, but most of them aren't. So how do we meet them where they are? How do we provide them with the leadership opportunities in a space where they can do this in addition to the lives that they've established and they want to live?
Thanks, everyone. But I think, Shelley, what you commented is that, you know, there's an ecosystem, that ECRs are part of a ecosystem that's sort of in parallel, interrelated with the patient partner ecosystem, and those two are interrelated. So listen, everyone, thanks for joining. It's been a really invigorating and stimulating session. Hopefully it's been helpful for all. This hopefully be the first of many to come. We'll send some information out about an evaluation, so please complete that either now or soon thereafter, and some resources. Then we'll be in touch about the in-person event, about some dates and times and what that will look like. And if anyone has interest in getting more involved with ideas, feedback, please feel free to reach out to us. And we'll have our emails in the email that will follow with evaluation. So thanks, everyone, and have a nice rest of the afternoon.
And before we say goodbye, we'd like to really thank all of our speakers who put together just really fantastic presentations. We really appreciate your expertise and your contributions to making this a successful event. So thanks, everyone.
I echo my colleagues' comments. Thank you very much. Hope that you found it useful. Just a little reminder, the Mentimeter will be open for a week, as you said, Rebecca. So if you have, you know, burning comments that you want to make, or any comments at all, or you know, please make them. And I see Peter there has put our contact information in the chat. And I also, up above, you'll see I placed the link to our short evaluation survey. If you could fill that out, that would be absolutely wonderful, because then this is co-design. This is, you know, driven by you as well. We want to hear, you know, we really take the evaluation seriously, and this will really help inform our next event and series of events. So thank you very much, but we will follow up in an email also with that link. Thanks so very much, everyone.